Welcome back to the channel. Today we're diving into a fascinating and essential topic in medicine, beta blockers. Whether you're a healthcare professional, a student, or just curious about how these medications work, you're in the right place. Let's break it all down. What they are, how they work, and when they're used. Let's get started. Beta blockers, also known as beta-adrenergic blockers, are a class of medications that primarily affect the heart and circulatory system. They are widely prescribed for a range of cardiovascular and non-cardiovascular conditions. But what exactly do they do? Essentially, beta blockers block the effects of adrenaline and other stress hormones on the beta-adrenergic receptors in your body. Let's talk about the mechanism of action. Beta blockers work by binding to beta-adrenergic receptors, specifically the beta-1 and beta-2 receptors. Beta-1 receptors are found in the heart and kidneys. Blocking them reduces heart rate, decreases the force of contraction, and lowers blood pressure. Beta-2 receptors are found in the lungs, blood vessels, and other tissues. Blocking these receptors can cause constriction of airways and blood vessels. This dual action makes beta blockers effective for certain conditions, but also explains why they can have side effects. So when are beta blockers used? Here are some key indications. Hypertension or high blood pressure, to lower blood pressure and reduce the risk of heart complications. Angina, chest pain, to improve blood flow to the heart. Heart failure. Certain beta blockers like carvedilol and bisoprolol improve heart function over time. Arrhythmias, to regulate heart rhythms, especially in atrial fibrillation. Post-heart attack, to prevent further heart damage and improve survival. Migraine prophylaxis, to reduce the frequency of migraines. Anxiety, to manage physical symptoms like rapid heartbeat and trembling. Keep in mind the specific beta blocker prescribed depends on the condition. Now let's look at some common examples of beta blockers. Selective beta-1 blockers, mostly heart-focused, atenolol, metoprolol, bisoprolol. Non-selective beta blockers affect both beta-1 and beta-2 receptors. Propranolol, nadolol, mixed alpha and beta blockers, block additional receptors. Carvedilol, labetalol. Each type has specific uses and characteristics, so choosing the right one is important. Beta blockers are generally safe, but can cause some side effects. The most common include fatigue and low energy, dizziness and lightheadedness, slow heart rate or bradycardia, cold hands and feet, shortness of breath, especially in people with asthma. While these effects are usually mild, it is important to discuss them with your doctor if they occur. Beta blockers aren't suitable for everyone. They are contraindicated in conditions like asthma or severe COPD. Non-selective beta blockers can worsen breathing. Severe bradycardia or heart block. They can further slow the heart. Uncontrolled heart failure. Beta blockers are introduced cautiously in stable cases only. Severe peripheral vascular disease. They may exacerbate symptoms. If you have any of these conditions, your doctor will consider alternative treatments. To summarize, beta blockers are powerful medications with a broad range of uses. Their benefits in treating cardiovascular and other conditions are well documented. But like all medications, they must be used judiciously. Always follow your doctor's advice and never stop taking them abruptly, as this can lead to serious complications. That's it for today's video on beta blockers. If you found this information helpful, don't forget to like, share, and subscribe for more in-depth medical content. And as always, leave your questions in the comments. I'll see you next time.